Hey everyone, and welcome. Today, we're going to be demystifying a journey that can feel incredibly complex and, let's be honest, pretty overwhelming, the breast cancer journey. We're going to break it all down, the science, the diagnosis, the treatments, and the road to recovery, to make every single step as clear and understandable as possible. So, let's dive in.
All right, so here's our roadmap. We're going to start at the very beginning, with that single cell that decides to go rogue. Then, we'll walk through how a diagnosis is actually made. We'll look at the main treatment options, and then we'll tackle the physical aftermath. And finally, we'll get to the really empowering part, the incredible role exercise plays in reclaiming your life. So, first up, the renegade cell. To really get a handle on what breast cancer is, we've got to zoom all the way in and see what's happening at the microscopic level.
Okay, so every single normal cell in your body follows this super strict, highly regulated process called the cell cycle. Think of it like a perfectly choreographed dance for growth and division. It's got all these checkpoints and safety measures to make sure everything is copied perfectly and happens right on schedule. It's a beautiful, controlled system.
Cancer happens when one cell decides to break all of those rules. It basically develops these 6 superpowers, which are known as the hallmarks of cancer. And what this really is a playbook for how a cancer cell behaves. It learns how to grow on its own, it ignores all the stop signs, it dodges the normal process of cell death, and it even figures out how to build its own blood supply to get fuel. It's basically a cascade of failures that turns a law-abiding cell into a complete outlaw.
So now that we have a sense of what cancer is doing at the cellular level, let's talk about how it's actually found. How do doctors go from just a suspicion to being absolutely certain about a diagnosis? For so many, the journey begins right here, with this question. And finding a lump? That's a moment filled with anxiety for anyone, right? So let's just pull back the curtain on the very methodical, evidence-based process that clinicians use to get clear answers. The gold standard for diagnosis is this really reliable 3-part process called the triple assessment. It's designed to be incredibly thorough. It always starts with a physical exam and a detailed conversation about your history. From there, it moves to imaging, like a mammogram or an ultrasound, to get a literal picture of what's going on. And that final step, if it's needed, is a biopsy where they take a tiny tissue sample to analyze. Putting all 3 pieces together gives the most complete picture possible.
So, during that very first step, the physical exam, what are clinicians actually looking for? Well, a potentially malignant mass often just feels different. It tends to be hard, it might have an irregular shape, and crucially, it feels kind of fixed in place, not like something that moves around easily. These physical clues are a really important piece of the puzzle that helps guide those next steps.
All right, once a diagnosis is confirmed, the entire focus shifts to action. So let's step into what we're calling the treatment gauntlet and look at the primary ways the disease is fought.
The first line of defense is almost always surgery, and it usually falls into one of 2 main categories. You've got the lumpectomy, which is a breast-conserving surgery where they just remove the tumor and a little bit of healthy tissue around it, and then you have the mastectomy, which is the removal of the entire breast. The choice between them really depends on a ton of factors, like the tumor size and exactly where it is.
Now, this next piece is absolutely critical for figuring out a treatment plan: the cancer's hormone receptor status. It turns out that about 80%, a huge majority of breast cancers, are estrogen receptor positive. All that means is that the cancer cells are literally being fueled by the body's own estrogen. This is such an important discovery because it opens the door to therapies that can either lower estrogen levels or just block the receptors on the cancer cells, basically cutting off their fuel supply.
So, beyond surgery, you're going to hear this term adjuvant therapy a lot. It sounds complicated, but all it means is additional treatments given after the main surgery. Chemotherapy uses drugs to hunt down any stray cancer cells anywhere in the body, while radiotherapy uses high-energy beams to target any sneaky cells that might be left in the breast area. The goal for both is exactly the same: knock out anything that's left and reduce the chance of the cancer ever coming back.
Treatment is a battle, for sure. And even after the fight is won, there can be some lasting effects on the body. So let's talk about managing that aftermath and overcoming the physical hurdles that can pop up.
One of the most common long-term side effects you'll see, especially if lymph nodes were removed, is something called lymphedema. It's a buildup of fluid that causes swelling, usually in the arm. And get this, it can affect up to 56% of patients, so this is not a rare thing at all, which makes managing it a really crucial part of the recovery process. Now, this condition isn't a simple one-size-fits-all thing. It actually progresses through different stages. It can start out subclinically, where you can't even see any swelling, and then move into stages where the swelling is persistent and the tissue itself can become hard. Understanding this progression is so important because it helps guide the right kind of management, whether that's compression garments or specialized physiotherapy.
The other massive challenge is cancer-related fatigue. And I want to be really clear here. This is not the same as just being tired. This official definition says it all, doesn't it? It's this profound, persistent exhaustion, physical, emotional, and cognitive, that doesn't get better with rest and just gets in the way of normal life. It's actually the single most common symptom that patients report. It's a very real thing.
So after going through the disease and the treatment, how do you even begin to reclaim your strength and just feel like yourself again? Well, our final section gets into one of the most powerful tools out there, exercise.
And look, the evidence for why exercise is so important is just overwhelming. We're not talking about some fuzzy theory here. We're talking about level A evidence that is the highest scientific standard there is. It proves that exercise improves strength, flexibility, and overall physical ability. And here's the really crucial part. It confirms that progressive exercise is totally safe and does not make lymphedema worse. That's a huge myth busted right there. And of course, maybe most importantly, it leads to a better quality of life.
So how do you actually put this into practice safely? Well, clinicians use these really clear evidence-based guidelines. The FIT principle, which just stands for frequency, intensity, time, and type, gives a perfect framework. It shows how a moderate, structured program with things like walking, cycling, or light weights is not only doable, but highly recommended even during active treatment to help manage side effects like that fatigue we were just talking about. So we'll end with this question. After all the complex cell biology, the tough diagnoses, and the grueling treatments, what if the journey back to yourself, that final, most empowering chapter in the whole story, actually begins with the simple, profound act of just putting your body back in motion? Thanks so much for joining us.